There are a lot of indications for intravenous therapy. Some of them are to establish or maintain the fluid and electrolyte balance of the patient, as I talked about earlier, to correct certain nutritional status of patients, to offer nutritional support to patients who can't take anything by mouth or taking certain medications by mouth is quite challenging, for administration of blood and blood products, for administration of certain medications like IV antibiotics, IV painkillers, and certain chemotherapy medications. There are different kinds of IV fluids. Usually, the healthcare provider will decide which type is right for you depending on why you need them. We have two main types of IV fluids. We have the crystalloids and the colloids. There are different kinds of IV fluids. Usually, the healthcare provider will decide which type is right for you depending on why you need them. We have two main types of IV fluids. We have the crystalloids and the colloids. Crystalloids are the most common type of IV fluids, and they contain small amounts of molecules that can pass through the bloodstream easily into tissues and cells. Examples of crystalloids are 0.9 sodium chloride, that is normal saline, and 5% dextrose in water. We also have lactated ringgits that contains sodium, calcium, potassium, and lactates, usually given to patients who have undergone surgery or have been injured. Colloids, on the other hand, are of higher molecules, so they can pass through cell membranes easily, and they are likely to stay in the blood vessels. Examples are albumin and hetastarch. IV fluids can also be classified as isotonic, hypotonic, or hypertonic solutions. Isotonic solutions have the same solute concentration as that of the blood plasma. Examples are the 0.9% sodium chloride I talked about, that is the normal saline, ringgit lactate, and 5% dextrose in water. They do not cause cells to shrink or swell up. A hypertonic solution, on the other hand, has a higher concentration of solute than that of the cells. As a result, fluid is being drawn out of the cells and the cells tend to shrink in order to balance the solution. Because of this, a person given a hypertonic solution needs to be monitored closely. An example of a hypertonic solution is 5% sodium chloride. A hypotonic solution, however, has a lower solute concentration than that of the cells of the body. Examples are 0.45% sodium chloride and 2.5% dextrose in water. Certain complications can also occur in the process of giving IV medications. Some of them are air embolism. An air embolism can also be called gas embolism. This is a very rare complication, but occurs when the IV line pushes too much air into the vein. It can have consequences such as death on the patient. It can also be fluid overload. That is when too much of the fluid is given quickly. Patients may experience headaches, trouble breathing, or have a high blood pressure as a result of the fluid overload. There's also another complication that can result from an IV therapy, which is called hematoma. This occurs when blood leaks from blood vessels into nearby tissues. It looks like a bruise, but usually resolves in few weeks. Phlebitis is also one of the complications, but the most common. It occurs when the vein becomes swollen because of the IV. This is also treatable by removing the IV line, applying a warm compress, and elevating the arm. Because IV medications go straight into the bloodstream, it is necessary that patients that are being entrusted in the care of nurses are being monitored closely. Some of the nursing interventions during an IV therapy are observing and checking for the right patient, right medication, right time, right route, right dose, and right documentation for continued care. Not forgetting to monitor for signs of complications as well. Thank you all for being with me throughout this video. Like and share for me. Subscribe if you've not done so yet. And also let me know your suggestion and comment in the comment section. Until I see you in the next video, keep shining. One of the various reasons why we choose the IV route or the intravenous route when giving medications is when the rapid onset of the medication is needed. Intravenous therapy is simply a medical term or a medical technique by which nutrients, medications, and fluids are administered through a person's vein. The fluids we use in this regard are called the IV fluids. IV fluids are just specially formulated liquids that are injected through the vein to correct or treat dehydration and also correct electrolyte imbalances. This whole process can be intermittent or continuous. Hello everyone, I welcome you all back to my channel. This is Time with Miss Joycelyn. If you are new here and it's your first time of watching my video, this channel talks about nursing and also offer health tips for a healthy lifestyle. I will urge you all to please subscribe for me, put on your notification bells for new updates, and also don't hesitate to give me your feedback, share your thoughts on my videos, and also give me all your questions that need answers in the comment section. Thank you. Today we are discussing IV therapy. We want to know what IV therapy is all about, what IV fluids are, why we use them, and why we choose that route to give medications.